An estimated 1.4 million Americans, that's approximately 0.6% of the population, identify as transgender. Transgender and gender non-binary individuals, TGNB, have existed since the beginning of time and in cultures throughout the world. For example, the Indian subcontinent has recognized a third gender community since ancient times. In Western medicine, however, the modern era of gender-affirming surgery began at the Institute of Sexual Research in Berlin, Germany, under the leadership of Dr. Magnus Hirschfeld. One of the earliest known gender-affirming surgery procedures performed in the U.S. was for a patient, Dr. Alan Hart, a transgender man who underwent a hysterectomy in 1910. Dr. Hirschfeld, who could easily be considered the father of transgender healthcare, coined the term transvestite in 1918. Defining as a desire to express one's gender in opposition to their defined sex, Hirschfeld and his colleagues used this now antiquated label as a gateway to the provision of sex-changing therapies and as a means to protect their patients. Dr. Hirschfeld was one of the first to offer his patients the means to achieve sex change through hormone therapy, sex change operations, or both. In 1922, Hirschfeld performed castration on Dora Richter, one of the Institute's employees, who later went on to complete her sex reassignment in 1931. The Institute's most famous patient was arguably Danish painter Lily Elbe, whose life story has been fictionalized in the popular film The Danish Girl. Starting in 1930, Elbe had 5 surgeries performed as part of her male-to-female transition, and unfortunately, Elbe died from infection-related complications of her final surgery in 1931. Now, around the same time that Dr. Hirschfeld's Institute began performing vaginoplasties, the father of plastic surgery, Sir Harold Gillies, had been refining techniques of genital construction in Britain. He primarily operated on British men who had sustained genital injuries during wartime. In the 1940s, he performed the first known phalloplasty for a transgender patient on Dr. Michael Dillon, a British physician. Dr. Gillies later performed a vaginoplasty on patient Roberta Cowell in Britain. In America during the 1940s, biologist Dr. Alfred Kinsey, who founded the Institute of Sex Research at Indiana University, now known as the Kinsey Institute, was one of the first to use the term transsexual in his gender studies. Now, the first American to undergo a sex change operation was Christine Jorgensen. She brought significant attention to the trans community in America when her story hit the New York Times headlines in 1952. Now, her willingness to publicly tell her story helped bring a face to the growing trans revolution in the States. But at the time, the lack of quality transgender healthcare meant that Jorgensen had to travel to Denmark to get the treatment that she needed. Following her successful treatment in Denmark by Dr. Christian Hamburger, many other transgender Americans wrote to Hamburger for the surgery. Hamburger referred those individuals to endocrinologist Dr. Henry Benjamin, who had offices in both New York City and San Francisco. Now, Dr. Benjamin's 1966 book, The Transsexual Phenomenon, left the most indelible impact on American transgender healthcare. And having spent time with Dr. Hirschfeld at his Berlin Institute, Dr. Benjamin supported the principles that those who feel their sex to be at odds with their gender deserve treatment in the form of hormonal therapy and reassignment surgeries and not psychotherapy for a quote-unquote cure.